Hello everyone. This week we're focusing on a key idea in both sociology and public health, your zip code. Your zip code can matter more than your genetic code. Let's talk about the social determinants of health. Here I have a book I wrote called Can Your Country Make You Sick? Where you live matters. Place matters. The things that shape our health outside of the doctor's office have a huge impact on health. Huge. And we don't talk about it much. And when I say this, I'm talking about things like your income. Can you afford healthy food? Can you afford a safe place to live that's mold free? Can you afford to live outside of a danger zone with environmental factors? Is your house not overcrowded? Is your education good? Did your school teach health literacy? Did it prepare you to navigate systems like insurance or the job market? These are medical issues, but they affect your health every single day. And the thing is, a lot of these things you can't change. You don't get to pick. You don't get to pick a lot of these issues that influence your health. Now, in sociology, we look at how institutions, schools, neighborhoods, workplace, transportation systems create patterns. So if we notice a certain area has higher rates of asthma, a biomedical model might say, let's treat that asthma. But a sociological approach or social epidemiological approach asks, are those homes near factories or highways, industry? Is there mold or poor ventilation in the buildings? Are there clinics nearby, or is care hard to reach? That's what a socioepidemiologist will look at. Health isn't only about biology. Contrary to what you might learn in high school, it's not just about biology. It's about how people live, where they live, and what they can access. And here's the thing, not everyone can access things equally. And that's what makes life so unfair. You don't get to pick where you're born. You don't get to pick your zip code. You might be wondering, why should Americans care about global health? Why should they care about social epidemiology? Because health problems don't stop at borders. COVID-19 showed us that a virus starting all the way across the globe can be on your doorstep in a matter of days. The world is more and more a global village, really. And also food supply chains get affected, medications, clean water, these are all global systems. What happens in one country can disrupt the lives and economies in another. So understanding health on a global scale helps us protect and improve health locally too. So even though we're here in rural Southeast East Texas, it matters what's going on overseas. So here's your big idea for the week. Health starts where you live, learn, work, and play. And if we want healthier communities, we can't just focus on hospitals. We have to look at housing. We have to look at jobs, transportation, and education, and how they work together. Because all of these factors influence health. This is where social epidemiology gives us a wider lens. And in every single one of my classes, you are going to be introduced to the social determinants of health. There is not a class except for, I would say, intro to sociology and research methods and medical cannabis, of course. But all of my health related classes, we talk about the social determinants of health because place and context matters. Where you live matters. You're introduced that concept in intro to sociology, but it matters for your health. So just think about it. We cover this in my environmental class. If you are living near industry, let's say down there by Lamar University, there is a neighborhood, the South End, the Charlton neighborhood. If you are living in that neighborhood, you are in a frontline community neighborhood, which means if there was an environmental accident to happen at one of the refineries, your neighborhood would be the first one to go because it's closest to the industry. And there are children living in that neighborhood. There are children who go to an elementary school right across the street from the refinery. Those children's lungs never get a break. And so that explains why in Beaumont you see higher levels of asthma here as compared to anywhere else in Texas. Anywhere else in Texas, that rates are highest in asthma right here. So where you live matters for your health. And most of us can't choose where we're going to live. Most of us really can't when you really look down to it, especially if you're a child. You live where your parents live. And here, many of you are living probably not far from where you grew up. We don't migrate very much. Not too far. Some of us do, some of us don't. So if you're in a rural community, your access to just regular hospitals and medical providers is so limited. Here in Beaumont, there's an urgent care almost on every corner. And like just 2 main big hospitals. So, but then compare that to a city like Houston, where there's a hospital on darn near every corner or pretty close to it. So think about the people who live in what we call food deserts. So to get to a grocery store to get fresh fruits and vegetables, they have to commute there. It's not just walkable. So then you just have the dollar store, the Dollar Tree, and the dollar store is just now, at least in my rural community, offering a very select amount of fruits and vegetables. So it's hard to get access for me to fruits and vegetables, fresh fruits and vegetables. I got to drive 20 minutes to the HEB, right? And then 20 minutes back. So just imagine if I'm on a fixed income or I don't have a car and I can't spend gas money like that, or I can't pay for Ubers, how am I going to get access? And if I'm not able to access these fresh fruits and vegetables, then my health is going to suffer. Same thing goes with physical activity. It's not, why don't you just go and exercise? Some neighborhoods aren't safe to go exercise. Some neighborhoods aren't safe because of violence. Some neighborhoods aren't safe because there's no sidewalks and the cars, and there might not be fences. Like in my neighborhood, you might get a really aggressive dog walking around because it's rural. And so then I want to go out and walk, but I can't because I might get some dog that I can't fend off trying to bite me. So where you live matters. Place matters. And in the entry of my book here, I speak about a receptionist. And I tell the story of a receptionist who lives in the different countries. I give a story about this woman named Anna living in the Netherlands, what her life is like, and then what if she lived in Ghana, and what if she lived in the United States of America? What would her life be like as a receptionist? Well, in the United States, she probably wouldn't have health care. She probably would not be able to afford to send her child to medical school. In the Netherlands, she'd have health care and she'd be able to afford to send her child to medical school. In Ghana, believe it or not, she'd have health care. She'd have health care. So I want you to realize that the genes and the biology of a person makes up just such a small smidgen of health. This is a chart that shows that really small smidgen of health. Really, this big yellow part here is all the social and societal characteristics that impact your health, whether or not your country has health care, whether or not your country has safety measures for gun violence, whether or not it's safe to walk alone at night, whether or not you have access to dentists, to fruits and vegetables, to road traffic safety, how your country is designed, then down to how in America, how your state is designed, then down to how your neighborhood is designed. So your city, then your neighborhood, all of those have an impact on your health. And you will see the social determinants of health model. Get to know it, read it, know it and love it, because it's so, so important. That's all I have for you guys this week. If you need me, I'm here for you. Just send me a message on Blackboard.